Good morning, wherever you are. This is Orion Reed from ConferenceHype. Our segment will focus on PCSK9 inhibitor treatment and outcomes in patients with atherosclerotic cardiovascular disease, but without prior ischemic events, an observational study. From the 2026 August 11 edition of European Heart Journal, Background, and AIMS, LMNA-related dilated cardiomyopathy, is a progressive genetic disorder characterized by conduction disease, malignant arrhythmias, myocardial fibrosis, and heart failure. Methods, spatial transcriptomics, and integrated single-nuclei multiomics were performed on explanted human LM and ADCM hearts to define endothelial transcriptional and epigenomic states associated with fibrosis. Results: endothelial populations exhibiting endo-MT-associated transcriptional and epigenomic signatures were identified in human LM and ADCM hearts. Discussion: RUNX1-driven endo-MT represents a central mechanism linking LMNA mutations to fibrotic remodeling in LMNA cardiomyopathy. From the 2026 August 14 edition of European Heart Journal, Background, and AIMS, the gut microbiota is a modulator of cardiometabolic disease. Methods: circulating MP levels were measured in independent prospective cohorts of patients with acute coronary syndrome, ACS. Swiss ACS cohort N equals 4787, Swiss cardiac magnetic resonance imaging cohort N equals 150, German ACS cohort N equals 1428, and chronic coronary syndrome. Results: circulating MP was associated with more advanced CAD and with cardiometabolic characteristics including diabetes and elevated high-sensitivity C-reactive protein. Discussion: gut microbiota-derived MP predicted MACE in patients with CAD independently of traditional risk factors and holds promise as a therapeutic target. From the 2026 August 5 edition of European Heart Journal, Background, and AIMS, the incidence of cancer in people with cardiovascular disease is poorly understood. Methods: participants were drawn from the European Prospective Investigation into Cancer-Norfolk study and followed up for a median of 26.2 years. Results: a total of 22,534 participants were cancer-free at baseline. 10,889 participants either had prevalent CVD at baseline or developed CVD during follow-up. Discussion: this study showed an increased lifetime cancer risk and mortality in men compared with women, which was mediated by comorbid CVD. From the 2026 August 11 edition of European Heart Journal, Background, and AIMS, transthyretin amyloid cardiomyopathy is a progressive cause of heart failure, especially in the aging society, but cellular biological mechanism studies are limited by the lack of robust animal models. Methods: humanized knock-in mice expressing either wild-type or V142I mutant transthyretin were generated. Results: both HTTRWT and HTTRV142I mice developed age-dependent cardiac amyloidosis with diastolic dysfunction and reduced survival, especially in the HTTRV142I strain. Discussion: two reproducible ATTRCM models that recapitulate the steadily progressive course of human disease were established. From the 2026 August 14 edition of European Heart Journal, Background, and AIMS, the cardiovascular benefits of icosapentinoic acid ethyl ester in MACE reduction might extend beyond its triglyceride-lowering effects. Methods: hypertriglyceridemia was induced in male rats by a high sucrose diet. Results: HTG plus EPAE animals displayed lower circulating TG levels and better cardiac function as compared to HTG group. Discussion: icosapentinoic acid ethyl ester treatment exerts direct cardioprotective effects, and ameliorates cardiac metabolic and lipidomic signatures after MI regardless of its circulating TG-lowering effects. From the 2026 August 14 edition of European Heart Journal, Background and AIMS. While inflammation and immunity are modifiers of atherosclerosis, immunological determinants of cardiovascular risk beyond the established inflammatory markers, high-sensitivity C-reactive protein, and interleukin-6 remain incompletely defined in humans. Methods. A nested case control study was performed within the Ludwigshafen Risk and Cardiovascular Health Cohort, a single-center prospective study of 3316 patients. Results. The integrated analysis strategy revealed immunological signals not detectable with conventional biomarkers, including a prominent signature of cellular proliferation, linked to activation, memory formation, clonal expansion, interferon signaling, and cytokine secretion in T cells. Discussion. Multiomic profiling of blood immune cells revealed novel immune signatures associated with CAD, short and long-term cardiovascular disease outcomes that are independent of systemic inflammation and may be used as risk stratification tools in the future. From the 2026 August 6 edition of European Heart Journal, Background and AIMS, risk factor associations for subsequent events among coronary heart disease survivors often appear weakened or paradoxical compared with first CHD event associations, confounding clinical interpretation and risk prediction. Methods. A retrospective longitudinal cohort study of 275,736 cardiovascular disease-free adults and 57,165 CHD survivors was conducted using linked electronic health records from England. Results. Absolute risk over 5 years was 32.4% in those with CHD compared with 1.33% in the CVD-free cohort. Discussion. Risk factor weakness after CHD appears to be a systemic phenomenon and consistent with the operation of index event bias. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 12 edition of European Heart Journal, Background and AIMS, to assess the prevalence of subclinical coronary atherosclerosis and its association with myocardial infarction, death or myocardial infarction, and clinically driven coronary revascularization in asymptomatic women and men in a Danish general population cohort. Methods. Asymptomatic women and men 40 years underwent coronary computed tomography angiography. Results. From 40 through to 80 years of age, women had less subclinical coronary atherosclerosis than men, both in persons with and without cardiovascular risk factors. Discussion. For the same degree of subclinical coronary atherosclerosis, women may have a lower risk of myocardial infarction than men. From the 2026 August 14 edition of European Heart Journal, Background, Medical Futility in the Cardiovascular Care of Older Adults presents unique challenges that necessitate a nuanced understanding of both clinical and ethical dimensions. Methods. This state-of-the-art review explores the evolving concept of futility in the context of an aging patient population and expanding armamentarium purported to treat even the most dire of cardiovascular diseases. Results. The first objective is to delineate a framework for clinicians to elicit the different dimensions of futility, their relative importance to the patient, and their potential for improvement with the intervention being considered. Discussion. Ultimately, informed shared decision-making with a patient-centered philosophy is essential to uphold dignity and enhance the quality of life for older adults facing complex cardiovascular conditions. From the 2026 August 12 edition of European Heart Journal, background and AIMS. Use of non-vitamin K oral anticoagulants is associated with reduced dementia risk in patients with atrial fibrillation, but their impact on cognitive function and clinical outcomes in AF patients with Alzheimer's disease remains unclear. Methods based on the Swedish Registry for Cognitive Dementia Disorders, individuals with incident AD during May 2007-December 2020, and pre-existing AF were identified. Results among 7308 eligible individuals, NOAC users exhibited significantly slower cognitive decline compared to non-users. Difference in MMSE scores beta equals 0.23 points here, 95% confidence interval 0.11036, and warfarin users. Discussion in patients with AF and AD, NOAC use was associated with modestly slower cognitive decline and more favorable effectiveness and safety profiles compared to warfarin or no anticoagulation. From the 2026 August 5 edition of European Heart Journal, Background and AIMS, in the relationship between periodontitis and coronary heart disease, the mechanistic role of subclinical atherosclerosis remains incompletely understood. Methods, data from the Swedish cardiopulmonary bioimage study were linked to national registers for dental data and CHD incidence. Results among 2956 SCAPIS participants, severe periodontitis was present in 6%, and was associated with severe CACS and severe CIS, with the strongest associations among individuals without concomitant dental caries. Discussion: severe periodontitis is positively associated with subclinical coronary atherosclerosis, EAT alterations reflecting inflammatory activity, and CHD event incidence. That's it for now for ConferenceHype's coverage of the August 2026 issue of European Heart Journal. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.